Hello everyone. Today's topic is hemoglobinometry. Today we will discuss about the principle, methods and standardization of hemoglobinometry. So today's contents of discussions are idea about hemoglobinometry, then general principle of hemoglobinometry, various methods of that, different instruments used, standardization, then importance of hemoglobinometry in diagnosis, and I also give you a takeaway message. That is the summary of the total content discussed so far. So this is the channel eduhub.2m. If you are new to this channel, please like, share and subscribe to get new videos every day. Let's have some idea about hemoglobinometry. So what is hemoglobinometry? It is a fundamental clinical laboratory procedure designed to precisely quantify the concentration of hemoglobin in a patient's blood, providing a direct assessment of the body's oxygen carrying capacity. We all know that hemoglobin is the only pigment of the blood which carries the oxygen from different parts of the body, among different parts of the body. And if we can clinically identify the amount of hemoglobin in a patient's blood, then we can also assess the amount of oxygen that is carried by that amount of hemoglobin. So this measurement serve as a clinical diagnostic and a monitoring tool for various hematological disorders. We know that there are two major hematological disorders are there. If the hemoglobin amount is low, the person is suffering from anemia, and if the hemoglobin level is high, then the person is suffering from polycythemia. So it's a good diagnostic tool which helps us to identify whether the person is suffering from anemia or polycythemia or not suffering from any problem. Now, results are routinely reported in grams per deciliter with established reference ranges that are influenced by the factor like the patient's age, then sex, and then overall physiological condition. So, this is the general idea about hemoglobinometry. So, it is a clinical laboratory procedure which helps us to know how much amount of hemoglobin is present in the blood of the patient. Now, what is the general principle of hemoglobinometry? The general principle of hemoglobinometry is rooted in the photometric measurements. That means we use a photo or a light to measure the amount of the hemoglobin. So, the photometric measurement of light absorbed by the hemoglobin or its derivatives present in the blood sample. Initially, whole blood is mixed with a specific reagent that lyses the blood cells. Lysis means it breaks down the blood cell, which in the hematological term we called hemolysis, and chemically converts all form of hemoglobin into a stable colored compound. So what happens when we mix the blood with some reagent? The reagent acts on the blood, it breaks down the red blood cells and the hemoglobin comes out as a stable compound. This resulting colored solution is then placed in a spectrophotometer or colorimeter, which passes a beam of light of a specific wavelength. And what is the wavelength? That is 540. And this is according to the Beer-Lambert law. The absorbance is directly proportional to the hemoglobin concentration in the sample, allowing for the accurate quantification. So this is the principle of hemoglobinometry. Hemoglobinometry actually works on the principle of Beer-Lambert law. So here are the various methods of hemoglobinometry. You can see that visual or acid hematine method, which is also known as Shally's method, then alkaline hematine method, oxyhemoglobin method, cyan methemoglobin method, sodium lauryl sulfate method, etc. So this cyan methemoglobin method, it is the international reference standard because it gives the most accurate result of hemoglobin. but it have the Drapkin solution to use, which contain the potassium ferricyanide and potassium cyanide. We all know that this potassium ferricyanide and cyanide, these are very high poison, very poisonous. So if we want to avoid the involvement of poison or the cyanide part, then we can go for this one, SLS method, or sodium lauryl sulfate method. This is called a non-cyanide alternative where hemoglobin is converted to SLS hemoglobin using the sodium lauryl sulfate, and absorbance is measured. It is safe, rapid, it is safe. That is the main thing. It is safe, rapid, and provides result comparable to the cyan methemoglobin method. So cyan methemoglobin method is the best one. But if we want to avoid the cyanide and ferricyanide poison, then we can adopt this method, SLS method, or sodium lauryl sulfate method. Now we will discuss about various instruments used in hemoglobinometry. As we can see, this is the Chalice hemoglobinometer set. So this is a small bottle which contains 0.1 NaCl, sorry, HCl, and here this is the comparator. You can see two colored beam between which there is a long tube which is called hemoglobin tube. This is figured over here, and this is the hemoglobin pipette. The maximum capacity is 0.02 ml or 20 microliter. This is the dropper which helps us to give the distilled water into the blood for the dilution. This is the stirrer with which we will mix the blood with the solution, and this is the whole set how it works. We have to take the blood in the hemoglobin tube. We have to, with the help of this hemoglobin pipette, we have to mix the acid with the blood with the help of the stirrer, and then we have to keep it for 10 minutes so that it can be converted into acid hematine, as because the other name of Chalice hemoglobinometer process is acid hematine process. And then we have to compare the color of that acid hematine, which is brown, with this comparator, and when we will see that the color is matched, and then we have to see the value of hemoglobin. So this is the Chalice hemoglobinometer set. So this is the next instrument, which is called cyan methemoglobin method instrument. This is the colorimeter, and this is the reagent which contains the ferricyanide and cyanide. And this is the standard that is supplied with the Drapkin solution. This is written here, Drapkin solution, you can see. So in this case, we have to take blood, we have to mix Drapkin solution with that, and you can see it in other video also, that is also present in this channel eduhub.2m, where the detailed process of cyan methemoglobin method has been explained. Then we have to keep it for 10 minutes for the conversion of the hemoglobin into a stable compound. Then that will be placed into the colorimeter for the beam to pass through the solution, and then the reading will be given here, and it will be calculated to know the exact amount of hemoglobin present in the patient's blood. So this is the most modern one, which is called the portable hemoglobinometer. We know, we have an idea about the portable glucometer, portable blood pressure machine. Now this is in the market, that is the portable hemoglobinometer. You have to place one drop of blood here, and it will directly go inside, and the machine will give you the result. And this is the result, you can see here, 10.2 millimole per liter. So this is the portable hemoglobinometer. So there are three major instruments. One is for the Chalice hemoglobinometer set, another for CyanMeth, and the third one for the portability. Now, what is the standardization? Standardization in hemoglobinometry means following strict rules to get correct and consistent result every time. So a machine should be standardized so that the correct result can be given to the patient party. The cyan methemoglobin method is used as the global gold standard. The laboratories use special reference solution to calibrate their instrument accurately. So regular quality check, running control sample, and participating in external testing program help detect and prevent errors. That means standardization is done to prevent the error so that a reliable result can be given to the doctor and there should be right diagnosis and treatment decision. So what is the importance of hemoglobinometry in diagnosis? Number one, it can diagnose the anemia. It is the primary test for detecting the classifying different types of anemia. We know that there are different types of anemia, but three anemias are very quickly diagnosed by this hemoglobinometry: iron deficiency anemia, megaloblastic anemia, and hemolytic anemia. Next is polycythemia. It helps in the diagnostic of polycythemia, abnormally high red blood cells, I have already discussed. Then monitoring the treatment response. That means if a person is found to have less amount of hemoglobin and some supplementation is going on like iron supplementation, vitamin B12 injections. So what is the improvement of that particular patient? That can also be diagnosed by the hemoglobinometry. Next, pre-operative and critical care assessment. Very important for the OT students. It is routinely performed before surgery and in emergency setting to assess a patient oxygen carrying capacity, helping the clinicians make informed decisions about the transfusions and pre-operative risk. Next, screening and public health. So it serves as a valuable screening tool in the mass health camp, especially the Shallis hemoglobinometer method. And it helps to identify the at-risk population so that they can be controlled. So last but not the least, this is the takeaway message. Number one is hemoglobinometry is a simple yet essential blood test that measure an oxygen carrying capacity of the blood. As because we all know that hemoglobin is the only way to carry oxygen throughout the blood. Next, it plays a critical role in diagnosing and differentiating anemia, polycythemia, and other hematological disorders. Next, accurate results depend on standardization method with the cyan methemoglobin technique being the global standard. Next, regular hemoglobin monitoring is very much important to track the treatment response. Then ultimately, hemoglobinometry is an indispensable cost-effective tool in routine clinical practice. That is very important. Routine clinical practice and public health screening worldwide. So these five are the take-away messages for hemoglobinometry. So thank you very much. Thank you very much for watching this with total patience. Hope you have understand the hemoglobinometry well. If you have any query, please feel free to comment in the comment section. And tomorrow I will again bring some new educational videos and hope to see you soon. Thank you.